I'm sure you've heard many tales and jokes about the exaggerated discomfort associated with root canal therapy. Although in the past some of these stories may have had some credibility, today most root canals can be treated rapidly, effectively, and without any discomfort. This video will show you what happens to cause the need for root canal therapy and why you need to treat the tooth as soon as possible. It will describe the actual therapy, the treatment alternatives, the risks, the costs, and what happens if you do nothing. It should calm you about this well-proven and important therapy. The image you are observing shows the typical anatomy of a tooth with one root and its supporting bone and gum tissue. Please note that inside every tooth is a small amount of soft tissue called the dental pulp, or you may have heard it called the nerve. In its natural state, this soft tissue contains nerves, blood vessels, and supportive connective tissue. And I assure you, it is definitely alive. This image shows a multi-rooted tooth with its large pulp and supportive tissues. The pulp is not far from the chewing surface of the tooth, and sometimes when dental decay is deep, the pulp is exposed, bleeds a little bit, and it often causes the need for root canal therapy. The teeth in the front of the mouth and a few of the back teeth have only one root and one root canal, while most of the back teeth have 2, 3, or more roots with root canals in each root. In the event of need for root canal therapy in one of the roots, all of the canals in a specific tooth must be treated. Teeth die for several reasons, the most common of which is deep dental decay, entering, infecting, and killing the dental pulp. Excessive chewing force on teeth can cause pulpal pain. Look at this guy. He's ground his teeth down to almost nothing, and some of them will be dead. A blow to the teeth can cause pulpal death, and there are many other less frequently encountered reasons. When the live components of the dental pulp are infected with bacteria and the pulp is no longer alive, the dead pulp debris and bacteria cause pain in the supporting tissues due to exit of the infection out of the root end of the tooth. Infected dental pulps can be one of the most painful of all human afflictions, but with proper professional help, the pain can be relieved relatively fast. You don't have many treatment alternatives. Allowing an untreated, infected root canal to go without treatment can cause extreme pain and very serious overall health complications. This is one of the few dental problems that can cause literally death. You either treat the infection with root canal therapy or you must have the tooth extracted. In most cases, it's better to treat the infected tooth than to have the tooth removed. Ask your dentist. As I said, avoiding treatment of infected teeth can have very serious implications, but properly treated root canals have been reported in studies to serve painlessly and effectively up to 96% of the time. The least treatment for a dead tooth is root canal therapy only, where a piece of rubber-like material is placed into the root canal after the canal has been carefully shaped and cleaned, followed by a simple filling in the chewing surface of the tooth. Complex tooth anatomy and root canal anatomy makes finding and filing and filling the root canals challenging for the dentist. Most of the tooth that's above the gums must be remaining to accomplish this very minimal treatment of root canal only. Most root canal treated teeth need additional treatment. Frequently, the tooth is so broken down that further treatment is needed. You will observe that a post has been placed in part of the root canal. The post may be metal, ceramic, or reinforced plastic. The post connects the root part of the tooth to the top part of the tooth above the gum. Sometimes additional screws are placed in the tooth to increase the strength further. Placement of posts is a separate procedure with an additional fee. Some teeth are even more broken down. What do we do with them? Often when teeth are treated with root canal therapy, a post is required, followed by a crown or a cap to cover the chewing surfaces of the tooth and to strengthen it. The crown usually requires 2 appointments, and as you might expect, it has an additional fee. The crown can be made of metal, tooth-colored ceramic, plastic, or a combination of these materials. Teeth treated in this manner usually serve for many years, and they feel, chew, and look just like normal teeth. Because it has a moderate amount of tooth structure remaining, this root canal treated tooth could have received either a conservative filling or a crown. If a tooth has a significant portion of the structure above the gums destroyed, a crown will provide further strength than a filling. The decision depends on the bite, the age of the patient, and the hardness of the foods the patient eats. After discussion with this patient, it was decided to restore the tooth with a tooth-colored partial crown. And look how beautiful it is. This image shows an extracted tooth that has 2 posts ready to be reduced in height and cemented into the tooth. 2 additional screws or pins have been added for greater retention and strength. Additional strong plastic material usually is placed around the posts and pins to build up the tooth, as you see in this next image. This clinical example shows 2 teeth that have received root canals, posts, and the white buildup material. They are ready to receive the final restoration, which in this case is a fixed bridge. This clinical example shows root canal treated teeth with posts and crowns. Occasionally, only one or more of the roots of a multi-rooted tooth can be retained, and the other root or roots must be extracted. This procedure is called a hemisection. After the root canal has been accomplished, the tooth restoration is cemented on the remaining roots. A hemisection does require an additional fee. This sounds like a lot of trouble. Why not just extract the infected tooth? Replacement of an extracted tooth requires a fixed bridge to be cemented onto the remaining teeth. Or, if other teeth are missing also, a removable partial denture can replace all of the missing teeth. Or dental implants with crowns placed over them. However, in spite of the additional cost of having these tooth replacement treatments, there are times when extraction really is the best alternative. Ask your dentist for advice about saving your infected tooth versus extracting it. Endodontic treatment is difficult, time-consuming, and tedious work for the dentist. Therefore, it's expensive. However, the success of this valuable therapy is well proven. Millions of endodontically treated teeth have been made free of pain and are serving their patients well. In spite of the known success of endodontic therapy, you will still have the final decision to make about saving that tooth or extracting it. The relative costs of root canal therapy and the related restorative procedures are as follows. Let's look at the treatment alternatives ranging from least expensive to most expensive. The least expensive treatment is the root canal alone, with a small restoration to fill a hole in the chewing surface of the tooth. But most teeth are far too weakened to receive this very conservative treatment. Next is the root canal, a post, and a crown over the chewing surface of the tooth. This alternative is the strongest and the most predictable treatment, but it may not be needed. Ask your dentist. If a part of the tooth needs to be extracted, the cost of this treatment is in addition to the root canal, the post, and the crown. And then there's extraction. Although this sounds like an inexpensive alternative, in the long run, replacement of the missing tooth can be expensive as well. You may or may not be in pain with your infected tooth. In any event, it needs to be treated. If it hurts, don't let the pain make you feel discouraged about the tooth. Very rapidly, the pain can be relieved by your dentist. Most infected teeth can be saved with simple root canal therapy. This therapy is relatively expensive, but the result is excellent. You still have the tooth. Keep in mind that replacement of a missing tooth is also relatively expensive. Unless the portion of the tooth above the gum is nearly totally destroyed, most dentists recommend keeping your tooth in your mouth. with adequate root canal therapy.